Is dexamethasone a treatment for all COVID-19 patients? Dexamethasone should be reserved for patients who need it most. It should not be stockpiled. It provided no improvement for patients with mild symptoms. Dexamethasone is a corticosteroid, which is used for its anti-inflammatory and immunosuppressive effects. For some COVID-19 patients who are on ventilators, a daily dose of 6 milligrams for 10 days improved their health. Fact: people should not wear masks while exercising. People should not wear masks while exercising as masks may reduce the ability to breathe comfortably. Sweat can make the mask become wet more quickly, which makes it difficult to breathe. The important preventative measure during exercise is to maintain physical distance of at least 1 meter from others. Fact: water or swimming does not transmit the COVID virus. The COVID virus does not transmit through water while swimming. However, the virus spreads between people when someone has close contact with an infected person. So what can you do? Avoid crowds and maintain at least 1 meter from others, even when you are swimming or at swimming areas. Wear a mask if you are not in the water and if you can't stay distant from others. Clean your hands frequently. Cover a cough or sneeze and use a tissue or bent elbow. Always stay home if you feel unwell. Fact: the likelihood of shoes spreading COVID-19 is very low. The likelihood of COVID-19 being spread on shoes and infecting others is low, but as a precautionary measure, particularly in homes where infants and small children crawl or play on floors, consider leaving your shoes at the entrance. This will help prevent contact with dirt or any waste that could be carried on shoes. Fact: the coronavirus disease COVID-19 is caused by a virus, not by bacteria. The COVID-19 is from a family of viruses, and antibiotics will not work against the virus. Some people who become ill with COVID-19 can develop a bacterial infection as a complication. In this case, antibiotics may be recommended by a healthcare provider. There is currently no licensed medication to cure COVID-19. If you have symptoms, call your healthcare provider or the COVID-19 hotline for assistance. Fact: the prolonged use of medical masks when properly worn does not cause CO2 intoxication or oxygen deficiency. They may be uncomfortable, however, it does not lead to CO2 intoxication or deficiency. Make sure your mask fits properly and is tight enough that allows you to breathe normally. Again, do not reuse this disposable mask and always change it as soon as it gets damp. Fact: most people who get COVID-19 have mild or moderate symptoms and can recover thanks to supportive care. If you have a cough, fever, difficulty breathing, seek medical care early. Call your health facility by phone first. If you have a fever and live in an area that has malaria or dengue, seek medical care immediately. Fact: the use of alcohol does not protect you against COVID-19. In fact, it can be dangerous and increase your risk for a variety of health problems. Fact: thermal scanners cannot identify COVID-19. They are successful in identifying a fever, and there are many causes of a fever. Call your healthcare provider if you need assistance or seek immediate medical care if you have a fever and live in areas with malaria or dengue. Fact: adding pepper to your soup or other meals will not prevent or cure COVID. Putting hot peppers in your food can be spicy and tasty, but will not prevent or cure COVID-19. The best way to protect yourself against COVID is to keep a distance from others, wash your hands frequently and thoroughly, and it's also beneficial for your general health to maintain a balanced diet, stay well hydrated, exercise regularly, and sleep well.